All right. Welcome everybody. We'll kind of get things going here. Start on time, or as close to time as we can. So good evening. My name is Abe Gardner. I work at the North Mason Regional Fire Authority. I'm the emergency prevention specialist up there. I'm also a person in long-term recovery, as well as an overdose survivor. So topics like this, community coming together like this, is near and dear to my heart. So I thank all of you for taking the time to come together tonight and to have some really important discussions and learn some really important information. Just some housekeeping items. So bathrooms are just over here. We've got some snacks, so cookies, 6 o'clock cookies, 7:30 cookies before you leave, and bottles of water over here. Also want to point out that we have 3x5 note cards, that if you want to write some questions down, maybe some comments, because before we close, about the last half hour or so, we're going to do some Q&A with the panelists. So if you do have some questions or comments, please grab some note cards, put them down, and we'll be able to read those to our panelists and get some feedback, some comments, and have some discussion. Also want to thank everyone that helped put this evening together. The City of Shelton for hosting, the Skokomish Indian Tribe, the Mason County Sheriff's Office, Mason County Public Health, True North, North Mason School District, Shelton School District, and thank you, Diedrich, as always, from Mason Web TV. And now I'll turn it over to Chief Bakken to talk a little bit about why we're here tonight.
All right, thanks, Abe. That probably works even better. So my name is Bo Bakken. I am his boss, actually, at the North Mason Regional Fire Authority. So it is good to have him working with us because, and kind of talks a little bit as to why we're here tonight is in our community, there are all kinds of substances. And one of the most dangerous substances that's out there is what we're going to talk tonight about, and that's fentanyl. We're on the horrific end when we talk about fire and we talk about law enforcement. We're going to talk about our role here in just a little bit, but we come in at the very last when we're dealing with overdoses, and we're dealing with pretty horrific situations. And we don't like doing that type of work. And so one of the things that we're trying to get more involved in is, one, getting our community prepared, getting it involved, getting educated as to what is going on out there with substances across the board, but again, mainly with fentanyl. So one of the things that's really important tonight, and I don't want to steal anybody's thunder that's on the panel, but the use of opioids, specifically fentanyl, is changing as we speak. If you go back 5 years ago, heroin was the big opioid of choice. Getting into OxyContin and getting into pills, that was really the opioid of choice and was for many, many years. Fentanyl certainly was on the scene. It's not a new medication. But at the time, fentanyl's use was very almost accidental. And if you fast forward to 2015, 16, 17 to where it is now, fentanyl has become the drug of choice and the substance use of choice. But with that, the impacts that drug has is very, 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 very damaging. And Christina will talk about that more here in just a little bit. And so this is not an easy conversation to have, and it's not a fun conversation to have, but it's one that a healthy community, or at least one that wants to promote a healthy community, it's a conversation that community does have, and that's what we're here to do tonight. What I do want to know is we let you know that, certainly we're having community forums like this, but you've got an entire public health team from Mason County, and you've got a whole host of partners that are working, and I don't want to sit there and say we're I think that we're actually working on the front lines to push back on what is happening with opioids, with substance use here in Mason County. And so it's not just about education and forums. There are people that are truly getting involved, and the work that they're doing is miraculous, and I hope that they will talk about some of the work that they're doing. Just this morning, when we talk about fentanyl use and opioid use, it is hitting every demographic. So there's a lot of stigma that's around fentanyl use and certainly opioid use. And if you look at if you quiz some people in the community, that stigma is very much there. That stigma generally circulates around that, people choose to throw their life away. They choose to make bad decisions. They choose to live this way. And, I can tell an addict when I see one. And I'm here to tell you, working for the fire authority, that is not the case. You see folks that are very well-to-do with very wealthy, elderly folks, juveniles, some of the ages that we're going to talk about today, pretty concerning and alarming, but it is hitting and impacting every demographic that's out there. And so when we talk about stigma, and it'll be a topic of conversation tonight, that's something that we're trying to change through education. And again, trying to talk about how it is impacting all sectors and all cross-sections throughout Mason County. The cross-section that we were putting particular focus on this morning, what we call the Mason County Opioid Stakeholder Group, is youth. And it's just alarming to see what is happening, and that's going to be some of the concentration we're going to talk about tonight, but fentanyl use among our youth. And so the age ranges, as low as we talked about today, 12 years old, that's happening. It's good to see some of our young people in attendance tonight because there's no young enough age to be able to learn about the effects of what's happening with fentanyl and other substances that are out there. But one of the things that we talked about is at our group today is, what are some of the challenges that we have within the system, and being able to provide education, treatment, services for youth. That is a big hole that's here in Mason County, and that's something that we as a county want to be able to sit there and watch that hole kind of collapse. And that's the process that we try to start getting underway today. So with that, what I'm going to do is I'm going to turn it over to a panel. Like Abe said, if you have questions, we're going to try to keep on time tonight. So we would ask that you hold all questions as far as raising your hand. But if you have questions, you're going to have note cards that you take. And then during the panel's discussion, please raise those note cards. Before we actually get into the panel discussion itself, though, we've got Christina Muller-Shin with Mason County Public Health, who is with us also this morning. And when I talk about being on the front lines of pushing back on what's going on in our community, that's the face of it right there. So with Christina, come on up, and I'll turn it over to you.
And I believe so. In 1 second, Christina, before you start. Once you do fill out a note card, you can get that to either Melissa or Rebecca. Melissa's back there from Public Health. And then also we just want to check in real quick. Sometimes these topics can really hit home, can be difficult, brings up all kinds of different emotions, and sometimes those spaces can be difficult to navigate. If you find yourself in that place tonight, please know that this is a safe place. We've got folks here that you can take a break and check in with. I know Jamie specifically from Public Health is willing to sit down and work through some of those difficult thoughts and emotions. So if anything gets difficult, please know that we're all here to support and want to support you through that. So keep that in mind. And without further ado, Christina.
I'm going to do a mic check. Great. Okay. First of all, thank you to everybody for coming today. Thank you to our panelists. Thanks to the team. We mobilized this pretty quickly. We had this idea about a month ago and said, hey, we need to do something to the community. And with all of our partners, we've been able to do that, which attests to the community we have in Mason County and the response that we've had. So my name is Christina Muller-Shin. I am a health specialist program coordinator at Mason County Public Health and Human Services. I have been working with folks primarily in active use since 2006. So that's kind of my specialty is drug user health, keeping people alive, education, harm reduction. And I do have a lot of friends that I've lost to overdose. So this is personal, it's professional, and I'm so proud of the community and everything that we've done in the last few years. And there's so much more to be done. So today, and I'm very nervous, which I'm usually very good at public speaking, but today I'm just going to talk about Fentanyl 101. What is it? What's happening? What are we seeing in our community? I'm going to debunk some myths. We're going to talk about fentanyl specifically around youth, and then we'll have our panelists talk about what they're seeing on their front lines and their perspectives, and then we'll have time for questions. So Ben, All right. So first of all, what is fentanyl? So fentanyl is a very, very, very strong opioid. It is a synthetic opioid, which means it is made out of a lab as opposed to opium-based medications or illicit drugs. And fentanyl is both pharmaceutical and there's a legal, what I say, illicit. So I want to be very clear that when we're talking about fentanyl and the risks of fentanyl and overdose, we're not talking about pharmaceutical prescribed fentanyl. And that's something I hear from a lot of folks is fentanyl patches specifically is really used in oncology care, end-of-life care, people with severe chronic pain. And because we hear so much about the fears of fentanyl and all the issues, some people who are recommended fentanyl by their doctors are nervous to take that medication. So I really want to make sure that if you are prescribed fentanyl from your provider for chronic pain, this is not going to apply to you. So I want to make sure that people are not afraid to take the medications that their doctors are prescribing them. So from now on, every fentanyl that we're talking about will be illicit or illegal fentanyl, which is made in labs, clandestine labs coming from China, Mexico, and made, there's lots of different types. There's about 26, 27 different analogs of fentanyl. And so fentanyl is now, all of those analogs. So one thing that I get asked all the time is, what does it look like? What does it look like here? So fentanyl comes in lots of different forms. It can be in powder, it can be pressed into counterfeit pills that look exactly like their pharmaceutical counterpoint. It's often sold as Percocet or Oxycontin. In Mason County, we mostly see the blue pills. This is from King County Public Health. They're called M30s, blues, 30s on the street. And we also see a lot of the fentanyl powder, what they call Fetty. And that's mostly what we see. But fentanyl is now being found in pretty much every single illicit drug that you can think of. Cocaine, methamphetamine, counterfeit Adderall. So at this point, the message is anything that you are not getting prescribed from your doctor yourself can contain fentanyl, likely contains fentanyl. The challenge with fentanyl is we don't know how much is put in it. So if you get a batch of pills, you could have one pill that has a lot of fentanyl, and you could have one pill that has no fentanyl. And so I could take the pill that has no fentanyl and say, hey, this isn't very strong, I'm gonna take a bunch more. And then I take the one that has a lot of fentanyl, and boom, I'm an overdose. So that's one of the messages that we really try to tell everyone is it's very inconsistent. We do not know what's in it. We do not know how much is in it. Each batch is gonna vary. So I'm a very strong proponent of education, and this is what I spend my time doing, talking to people, so that they know what the risks are. Okay. Next slide, please. Now I'm gonna have a bunch of very text-heavy slides. I'm gonna read from them. This is taken straight out of a paper that was published in 2021. From Caleb Bantagreen and Jay Williams from the University of Washington's Addictions, Drug, and Alcohol Institute. The paper is called Dramatic Increases in Opioid Overdose Deaths Due to Fentanyl Among Young People in Washington State. And these folks are amazing, and they just did such a succinct job, so we will just be reading excerpts from that. So why is fentanyl so dangerous? What is going on? Why are we seeing so many fatal overdoses from fentanyl right now? And what are the risks for fentanyl compared to other opioids? So other opioids can be morphine, Oxycontin, Percocet, heroin. So there's a whole host of, both prescribed and illicit opioids, but fentanyl is extraordinarily potent. One of the reasons that fentanyl is so dangerous is it has a very high risk for rapid addiction and overdose. Fentanyl is also strongly associated with much higher rates of fatal overdose among young adults than other forms of opioids in the recent past. A pill that looks like a legal prescription opioid may provide a false sense of safety, especially among younger people who are less experienced with drug use and who, in general, tend to underestimate personal risks compared to older adults. Next slide. A very small amount of fentanyl produces a very strong effect quickly, often within seconds, that also goes away quickly within minutes. The rapid and short effect of fentanyl means that it has a very high addiction potential as well as a very high overdose potential. Because fentanyl causes rapid tolerance, people who use it regularly will quickly need more drug to get equal effect. Younger adults in particular may believe they cannot become addicted to fentanyl because they are healthy, using a pill that does not look illegal, and they are not injecting it. However, many people are quickly becoming addicted to opioids who have used no opioid other than fentanyl and have never injected it. For those who are using fentanyl regularly and having bad effects like overdose, loss of control over use, and/or cravings, they may well have an opioid use disorder. Fentanyl is on trajectory to increase opioid addiction and overdose among young adults and replace heroin as the predominant opioid among those 30 and older. So we hear on the media a lot of fear around touching fentanyl and overdosing, and we've seen this perpetuated in the media a lot. And that's actually a myth. You can't actually overdose from touching fentanyl. And I have a lot of research that backs that up, so if anybody wants to have a further discussion, I am more than happy to have that. I have another quote here. This is from the medical director for toxicology and addiction at the University Hospitals in Cleveland, saying, "We have a lot of scientific evidence and a good knowledge of chemical laws, and the way that these drugs work says that this is impossible. You can't just touch fentanyl and overdose. It does not just get into the air and make people overdose." So you can absorb fentanyl through the skin with the fentanyl patches, but those are chemically altered specifically to be absorbed transdermally through the skin. So I can touch fentanyl all day and I'm not going to just absorb it. If that still makes you question it, logically speaking, we just don't see it in the numbers. So one thing that I do for my job is we do very detailed overdose surveillance. We get reports from the emergency department, we look at the coroner's log, we get reports from every overdose for law enforcement, from fire, EMS, et cetera. We are tracking overdose. I am looking at every single overdose case that goes through the 911 system, in addition to talking to people who are overdosing and getting Narcan from us. And I can say that every single overdose that has happened in Mason County, except for a few, but they were still ingested, were from people who were intentionally taking substances. I also work closely with folks all around the state who are doing overdose surveillance, and again, I can say that we have no verified accounts of anyone accidentally being exposed from the environment from fentanyl. All overdoses are happening from people who at least know that they're taking a substance. Next slide. So what are we seeing in Mason County? What are we seeing in Washington? What's going on around the country? So illicit fentanyl it's been around in the US for quite a while now, probably about 2 decades. When I started doing this work in 2006, I think it had just hit the East Coast, and we were seeing 30 people overdosing in Philadelphia in one day, and that was really wild. That was pretty unheard of over there. So we've watched it kind of become the most predominant opioid in the East Coast and then moving its way west, so it hit Midwest. They've been battling with fentanyl for quite a while. And then it hit the West Coast. And Washington was still a little bit protected from fentanyl, while California was seeing a lot of it. And then it made its way to Washington. And then still further, Mason County was protected. We were one of the last counties that really were seeing fentanyl, but it did hit us a couple of years ago. It first came in those counterfeit pills. When we first had it, people didn't know that there was fentanyl in the pills. They thought those were prescription pills. So there was a lot of education around, a lot of the education was focusing on there might be fentanyl in your substances. Be careful, there might be fentanyl. And now we've seen a shift again where that is a substance. Most people know that they're taking People who are actively using drugs who are taking it at this point pretty much know that there's fentanyl. There's still folks who are what we call drug naive, who don't really know what's going on. Maybe they're dabbling. This is really risky for young people who are really know nothing about substances, and they have an opportunity to try a pill. So there is still some people who are accidentally using fentanyl who really are not intending to use fentanyl, but a lot of the folks that I'm working with, at least, who are actively using regularly know that it's fentanyl and they're seeking fentanyl out. We're not alone. Go back, Ben. We're not alone. You know, our overdose rates are definitely reflecting this increase in fentanyl. We've had many more overdoses in the past year, both fatal and non-fatal, than we have in previous years. But again, this isn't just Mason County. We're seeing this statewide and nationally. So this is really a national crisis at this point. So I guess there's no comfort in that, but at least, you know, we're in good company, and there's a lot of folks working really hard to address this and working very creatively to address this. When we're talking about young people using, I think it started becoming on our radar about 8 months ago that we were really seeing pretty much teenagers starting to use, and we have seen some overdoses from young people, and one of those overdoses is the reason why we gathered today and why we kind of came together so quickly and said, hey, we need to talk to the community about this. But we really weren't seeing it very much last year. We really weren't seeing this a few years ago. Every once in a while we would, but around 8 months ago, we really started in conversation saying, hey, there's an issue. Hey, this is kind of increasing to rates that we're really not comfortable with. But the truth is most people are not using fentanyl. And so we don't want to instill fear. This is not a fear-based talk today. We are not trying to give any misinformation. When we're looking at what young people are doing, we're seeing a lot of alcohol, we're seeing a lot of marijuana, we're seeing a lot of really high concentration THC from the vapes and all whatever. I can't even keep up with what's going on with marijuana these days. So when we're looking at the emergency department data, the substance that we're mostly seeing young people coming into for health emergencies, for substance-related health emergencies, is alcohol and marijuana. So I really want to make sure that we're, when we're talking today, because we're going to have a panel of people who are working with folks who are mostly using fentanyl or who are in treatment or engaging in law enforcement. I don't want us to get sidetracked and make it seem like everyone is using fentanyl, because for the most part it is not. It's a select few, but it's still problematic. So I'm going to share some Healthy Youth survey. This is a survey that goes out, I think, every 2 years through the schools. And many of our schools and school districts are doing this. So this is a pretty comprehensive survey around a lot of things, but they do ask questions around substance use. So we do have 2021 data that came out fairly recently, and so I'm going to show a few things just to get an idea of what's going on with our young people. Next slide. Okay. Oh, I got to change my slides too. So this is a chart. So there were 314 students surveyed, and this is a graph that compares Mason County with Washington State percentages. This is current past 30-day illegal drug use. So they asked, have you used an illegal drug in the past 30 days? And as you can see, we're a little bit higher than the state average, but not that much, right? So, and actually we don't have enough to show for 6th graders and 12th graders, but about 1%. When we're looking at the 8th graders, we can say that 2% of the students surveyed, so again, this is not a perfect study, this is which students were in class that day, so are the kids going to school, are they not going to school? None of our data points are going to show a total accurate picture, but we can piece together the little bits of data that we have to show, you know, a bit more of the picture. So 2% of 8th graders said, I have used an illegal drug in the past 30 days. And 2% of 10th graders have said, I have used an illegal drug in the past 30 days, compared to 1% of the state average. This is a breakdown of what substances 10th graders have used. So of the students who have used a substance in the past 30 days, so again, this is not all students in 10th grade saying I've used these. These are of the students who have used a substance in the past 30 days. This is kind of the breakdown of what they're doing. So 3% have used cigarettes, 11% have used alcohol, 14% has used marijuana, 1% have used prescription painkillers to get high, 2% have used prescription drugs not prescribed, 3% have used over-the-counter drug use to get high, and 2% have used all other illegal drugs, which would be methamphetamine, heroin, cocaine, etc. So our numbers are pretty small, right? Again, we want to reiterate that most youth are not using substances. Most youth are not using drugs. But one is too many, and that's why we're here today. So we don't want to discount the very, very tragic realities that are happening within our youth and the struggles that are happening with our families, but we did want to give a little bit of a data breakdown. So what are we doing? Mason County has been working very diligently since 2017 to address substance use and mental health. I'm extraordinarily proud of our county. I've been working, again, for quite a while in this field. I've worked in urban areas and in rural areas, and I can say that we are really looked upon through the state right now as leaders in this. People are extraordinarily impressed with what Mason County has done as a very small rural county with less resources than King County or Thurston County or some of our bigger counterpoints. So Bo mentioned our opioid stakeholder group. This is a group that's been meeting every other month since 2017. We did not stop for the pandemic. This group is pretty big. It consists of lots of different partners from all different sectors of our community. We have the public health department, we have treatment providers, we have mental health providers, we have our school districts, we have law enforcement, we have Mason Transit Authority, we have, the list is pretty long. And that's also fairly unique to have such a group that is very engaged, consistently engaged from all over. And we have been able to do amazing things with those partnerships because we're meeting regularly, because we're talking about it. We're always bringing up where are the gaps? What do we need to do to fill in the gaps? I was just looking at our opioid response plan. We did let it lag from COVID. It was from 2016 to 2019. So we clearly need to do our next 5-year plan. We have accomplished almost every single task that we set out to do in 2016. That's pretty amazing. We have brought millions of grant dollars into the county to start new programs and to sustain other programs. We have programs in prevention, in harm reduction, in treatment, and in recovery supports. We've given out thousands of Narcan kits throughout Mason County. There are 2 programs that I really want to highlight because these are pretty unique and were a direct result of us listening to the community and saying, this is a big gap. This is something we really need to fill. So the first is our behavioral health transportation program. Raise your hand if you've heard of our transportation program. Okay, so a good amount of you. It also shows me that we need to get the word out a little bit more. So our behavioral health transportation program has 2 components. We have an in-county component. First, let me describe what we consider to be behavioral health. So we have a very broad definition of behavioral health and recovery supports. We recognize there are so many aspects of our lives that contribute to our treatment and our recovery. So court dates, going to your UA, going to your outpatient, your 12-step recovery meeting. Sometimes it's getting your ID because you can't go to services if you don't have your ID. Sometimes it's medical appointments that are related to your substance use, like a soft tissue infection. So we have a very, very broad definition of recovery support. And in Mason County, in partnership with the Paddy Wagon, anybody can call for themselves and say, I'm part of the behavioral health program, and they will drive an individual anywhere in Mason County for their appointments. So, hey, I need to go to an AA meeting in 2 days. They will pick me up from my house and take me to the meeting and bring me back home. I need to meet my probation officer tomorrow. I call, okay, they'll take me to meet with my probation officer and back. That's really unique. I don't know of any other programs in this state, at least, that have that. It has a second component. There's the out-of-county transportation. So if somebody needs to go, and this is probably for a little bit higher level of care, like inpatient. Mason County doesn't have very many inpatient services. We have Northwest Resources, which is a male-only 16-bed, a great resource, but does not fulfill the needs of all of our community members. So the out-of-county transportation is in partnership with Gethsemane Ministries, and they will drive someone anywhere in Washington State for treatment or other select recovery supports. I'm going to share a story of how some of our programs have worked. I got a referral from somebody who wanted to go to detox. I spent a couple hours on the phone with them. They weren't sure if they wanted to detox at home or go to a facility, and after a lot of conversation, they said, I think a facility would be a better choice. Didn't have insurance. So we tried to use our insurance navigators, but it wasn't happening that day, and it was getting towards the end of the day. And so I talked to Jamie, and Jamie said, hey, I know of a place that doesn't require insurance. The individual was able to call. They had an opening that night. Well, how are we going to get you there? It was in Whatcom County. So we called the Gethsemane Ministries, and they said, okay, we'll leave right now. We'll be at your house in an hour. So within 2 hours of me getting off the phone with this individual, Gethsemane Ministries was at their house, took them to that detox center, and then when they were done, were able to bring them back. And that's pretty cool. I mean, that's pretty amazing, and that was directly because we were hearing from our community that transportation was one of the biggest issues in Mason County. We are rural. A lot of people don't have access to cars. We don't have money for gas. So that's a gap that we really are working hard on filling. We do have flyers, by the way. All of the resources that I'm talking about today, we have 1 million flyers at the public health table over there. And I also want to highlight our Behavioral Health Navigator program, which is in partnership with the Shelton Police Department and the Mason County Sheriff's Office. Jamie Ellertson with Public Health is our navigator right now, and she does a lot of outreach. She does not just do navigation, but because we're talking about youth today, we just really wanted to emphasize that if anybody has a young person who is struggling to get into services, and we're going to hear from other professionals who work with youth specifically, but Jamie is extraordinarily passionate about helping young people, so please contact her if there's any challenges or if they're engaging with law enforcement. That is something that we are really happy to fill, and she has her contact information. I also want to say that there are still a lot of gaps in services for youth in Mason County. As Bo mentioned, most of our services have really focused on adults, at least the public health run services have really focused on adults. And that's an area that we're really focusing on right now. There have been several tragic circumstances in the recent times that have really opened many of our eyes to those gaps, and that's something that we are working really hard to address. And again, at our stakeholder meeting this morning, we had a whole panel on youth and substance use and what programs do exist and where are the big gaps. And we will be taking this up to the state level because there are a lot of statewide gaps that are really existing. This is not a Mason County problem. This is a Washington program or Washington problem. So overdose is kind of my passion. That's my specialty. I've been working very hard for a very long time on preventing overdose. So again, every one of us has a piece in the puzzle to play, right? So I'm not a treatment specialist. I'm not a navigator, but I am a specialist in overdose prevention and talking with people about being safer. So we do have a pretty great, I'm going to toot my own horn, pretty good Narcan program here. We're not the only ones you can get Narcan from, but we are one of them. I can deliver Narcan anywhere in Mason County to anybody for free. It's an anonymous program. I want to make sure, well, first of all, for those of you who don't know what Narcan is, because I'm talking like everyone knows, Narcan is a very safe medication that reverses opioid overdoses. There's a nasal form and injectable form. There's a statewide standing order, so anybody can actually get Narcan from a pharmacy, and all it does is reverse an opioid overdose. So there's no harms that can happen if you use it and that person isn't in overdose. And it's very safe. It's safe on children, it's safe on pregnant people, it's safe on animals. And there's also no age restriction on carrying Narcan, so anybody of any age can have and can use Narcan. I can provide trainings for individuals, I can do group trainings, I can do trainings for professionals or for agencies on demand, so just call and schedule one for me. No group is too small, so we can do, I did a little community group on Harstein Island at their little center of, 5 people. I've done families. I've done these with 3 generations in somebody's living room. So again, we want to make getting access to this life-saving medication as easy as possible, so please do not hesitate to reach out. We also have lots of other parts of the county that you can get this for free through our program. And as I mentioned, there are other access points as well. I am going to be hosting a community overdose prevention and response workshop at our Shelton Timberland Library on December 1st. It's Thursday from 5:30 to 7. We have flyers available, so we'll talk about opioids and stimulant overdoses, because we do actually have a lot of overdoses involving meth and cocaine, so you can absolutely overdose from stimulants. We'll talk about learning how to recognize and respond to overdose, how to prevent overdose, how to use Narcan, and you can get a free Narcan kit at the end. So again, we have flyers. Please do not hesitate to reach out to me if you have any questions. So good news, we have trained 878 individuals on how to use Narcan, how to respond to overdose. I just tallied up the numbers, so these are current as of October 2022. We have given out 3,821 Narcan kits, and of the people that I have been able to reconnect with for a refill, so if somebody comes to me and say, well, what did you do with your last Narcan kit? Oh, I used it in an overdose. So I can say that we have data on 343 successful overdose reversals in Mason County since we've tracked in 2017. Again, that's an underreport. Those are just the people that I've been able to reconnect with. So that's pretty amazing. How am I on time? I don't know what time I started. Real quick, I want to talk about the Good Samaritan overdose law in Washington State. In our RCW, it is legal. If you seek medical help for someone having an overdose, neither of you can be charged for having or using a small amount of drugs. So you're not going to get arrested for possession or paraphernalia. It does not apply to outstanding warrants, probation, or parole violations, drug manufacturing or delivery, controlled substance homicide, or other crimes besides drug possession. And next slide, I have a select few resources. Our website, healthymasoncounty.com, has lots of resources with hyperlinks. There's the medication take-back boxes. Again, this is, we have them in all different parts of the county through pharmacies. We do have flyers for both North Mason and, I guess, Central South Mason. I don't know what you call the lower half of the county. So these are boxes that are available every day that the pharmacies are. One of the best things that we can do for prevention is get unused medications out of the homes, out of the community, out of circulation. So please use those take-back boxes. We're lucky a lot of places have National Drug Take-Back Day, where it's a one-day event where everyone can bring their meds and dispose of their meds on that day. And we have, I think there's 7 now, year-round take-back boxes. Learnabouttreatment.org is an amazing website run by the University of Washington. So is stopoverdose.org. Stopoverdose.org has a youth overdose education page, as well as a fentanyl basics handout. We have some of those fentanyl basics handout. And they also have resources from Public Health Seattle King County on talking with teens about fentanyl. So King County has done a lot of good things around youth and fentanyl. And I do have a peer-reviewed paper on fentanyl exposure risks to emergency responders. And I think that's it for me today. Thank you.
All right, everybody. Thank you, Christina. We will now get into our panel discussion. Everybody got their white cards ready? Any questions come up, again, just go ahead and fill out those cards. And we are going to start off with Sergeant Lawson, if you don't mind. Come on up.
Good evening. I'm Sergeant Lawson, Shelton Police Department. I've been with the department for just about 6 years. A little about me. I started out as a patrol officer here, went and worked as a school resource officer, where we started to see kids using alcohol and marijuana quite a bit. As kids, they try and experiment, take some pain away, and see what's out there. Once COVID hit, I moved into detectives. After that, I got promoted to sergeant here about May this year. And honestly, we had heard kids using heroin, meth, cocaine, a little bit of everything. And what I'm about to say is not to put fear into any of the parents. It's about education. We want to educate everybody, and I want you to know that I also have talked to the family, reason why we're here, and have some permission to speak on the incident that why we're here. We Narcaned a lot of people as law enforcement. We were running out of Narcan. We were using it so much. We didn't realize how some youth were actually seeking out fentanyl until July 16th of this year, when we went to an overdose of a 17-year-old who wasn't breathing, didn't have a pulse. We Narcaned him, CPR'd him, Narcaned him again, more CPR, and barely brought him back. His friend Evan was there, and it scared him. You know, we had more issues with kids using, and it's particular kids. We've got about 20 of them that we know of that use fentanyl, and specifically target using fentanyl. That's their drug of choice. I saw Evan a couple days before he passed, and working with juvenile probation, I told Evan I did not want to see him end up as an overdose or a statistic. I had the unfortunate time to respond to his overdose. I had to tell his mom that he overdosed and we couldn't save him. Since then, we had a couple other youths overdose, and they're thinking that Narcan is the magic fix-all, and they can use fentanyl. It's just going to bring them back. Some of these kids are using alone, and you're not going to Narcan yourself. Sometimes you're out and you don't know. They think that this is just a fix-all. It's difficult for my officers and myself and the community, juvenile probation that's here in the audience tonight, to work with these kids. We build relationships, and we're seen as cops, and we can be the bad guys sometimes, but we work with these kids and we build relationships. We want to see them succeed and move forward. We don't want to see them stuck in this rut the rest of their life. So we have a vested interest in seeing these kids be successful and get the help that they need. I know that I met Christina recently when we had run out of Narcan, because we have adults that use fentanyl quite a bit. And when we were out, Christina told me, we got talking about the youth and the problems that we were seeing. And that's what kind of brought us into a little bit more conversations about this. And we want the community to be educated and not just afraid everybody's going to use it. There is a lot of good panelists up here today that have a lot more information than I do. And I hope that you guys are just willing to kind of open your ears and be ready to take in some of this information and understand what it is and how we can all, as a community, fight the fight on it. So I will pass it on. Thank you.
Thank you, Sergeant. Maggie, come on up. And if you don't mind introducing yourself.
Hi, my name's Maggie. I am one of 2 nurses for North Mason School District. I work at the middle school, high school, and then James Taylor, the alternative school. So far as fentanyl use, luckily we haven't seen it actually in the schools yet. We're seeing a lot more of the THC, mostly in the forms of like the dab pens. There have been, because me being the nurse for the high school, there's definitely been kids that are on other substances, but they haven't had them with them. So as far as what they are, I'm not sure. I do know that Kitsap County, though, has already seen they're the fake Percocet 30s, which are fentanyl, already in their middle school. There was last year where a middle school student actually got hospitalized, had to basically get their stomach pumped for it. So it's already in our, a neighboring county at that young of an age. Right now, for what North Mason School District is doing is we really wanted to make sure we were getting Narcan in and around just the district, because we know that it is going to be, we haven't seen it yet, but we don't want it to be where we have a student overdosing or even just somebody out in the community who's on there, and we can't do anything about it. So we actually did have, Christina came out, I think it was last month, and trained all of the admin. We now have, I think it's 4 doses of Narcan for each of the buildings in the district. So, because with the fentanyl, 1 dose isn't, from what we understand, isn't going to be enough. I think the fire department was telling us it's been as much as 5 sometimes. Other than that, luckily it hasn't impacted us yet, but we're prepared for it.
Thank you, Maggie.
Hi, I'm Sarah Ellsworth. I am the Regional Administrator for Behavioral Health and Student Support at ESD 113, working with our True North program. Here in Mason County, we provide comprehensive behavioral health services that include prevention and early intervention for behavioral health issues. So those are students or young people that are exhibiting early signs of substance use or early signs of mental illness, but maybe don't meet criteria to be diagnosed with a disorder yet, and they can get some supports and services. We also provide outpatient substance use and outpatient mental health treatment. And we provide as much recovery or aftercare support as we can, but we are fairly limited in that. So I want to reinforce a lot of things that have been said, one of which is most students are not using drugs or alcohol. I think that's really important for a lot of us to remember. Most of our community is healthy and safe and well. We look at the numbers, most of our kids are choosing not to use substances, and that's really good news. We also have a group of students who are actively using and who are very sick. One of the things that I've noticed over the course of my 15 years at True North is that the amount of complex ongoing trauma that our kids are coming into services with is pretty dramatic, and that the students who are using more significantly and using substances of much higher potency than they were previously. And so with fentanyl, that's one of the things that's really scary is we have an adolescent brain, a highly reinforcing substance, and addiction can happen really quickly. The group of young people that we're most concerned about are those who are intentionally using fentanyl. They're seeking it out and they're intentionally using it. People are intentionally distributing it to them. That's also very concerning. And we also have other students who we're seeing more and more believe they're using something like a Xanax, or they believe they might be using meth, and they are being exposed to fentanyl. So one of the big messages that I heard Christina say is if you are using any substance that was not prescribed to you, that did not come from a pharmacy, that is illicit, there is a likelihood that it will be laced with fentanyl and you could be at risk of exposure. So with that, one of the things that we're doing, we're required now by law as outpatient providers to provide naloxone or Narcan to any young person who's using substances that are opioid related that are not prescribed to them. So we are handing out naloxone. We've handed out quite a bit, probably most in Mason County compared to the rest of the counties that we serve. So the intention of that legislation and what we're trying to do is put naloxone in the places where overdose is most likely to happen. As a concerned citizen, I might have some in my car, not very often in a situation where somebody's going to be overdosing. So really what we want to do is saturate the community with that being available and accessible. With that, we know it saves lives. We also know that there can be a false sense of security with that naloxone being distributed, particularly if you're using alone. Most people don't know they're going into overdose. Most people are not able to reverse that overdose for themselves when they are by themselves. And also misunderstanding that it can take multiple attempts, misunderstanding that I can give somebody naloxone and I don't have to call for backup or reinforcement. So that's why I think for education purposes that Good Samaritan law is so important. If you're in a situation where you have to administer naloxone, you should also call 911 and make sure that emergency medical is on their way and ready to respond, and know that you can do that safely even if you've been using yourself. That's really, really important. I think one of the big pieces too for takeaway for parents, for young people, the best thing we can do to respond to youth and use is to not begin in the first place. And so when we talk about what we can do, we can talk to our kids early, we can talk to them often, we can make sure that they know what the risks are, we can open the door for conversation. I have 3 kids myself. They are almost 12, 9, and 7. And I was telling Ben this morning, I was like, gosh, I have to talk to my own kids. Like, I have to practice what I preach. So I sat down and had this very lovely conversation with my 12-year-old, and I'm like, I'm a professional, right? Like, he's going to take me very seriously. And he looked at me and was like, Mom, if I have questions, I'm going to go to this person, which is his best friend's mom, who's a doctor. And he's like, she's going to know way more than you do about that. And after my pride was wounded, I was like, you know what? He has people in the community, whether he goes and talks to her, whether he comes and talks to me, whether he goes to talk to Dad, he has people that he can go and talk to. And I think that that's what we can do in the community is we can start conversations and we can be an open adult who's ready and available for any young person who brings that to us. Last thing, the other thing I told him is be very mindful of where you get your information, which is why it's important that you come talk to me or another trusted adult. Go to some of these websites that are vetted, because there's a lot of stuff on the internet. There's a lot of stuff that's not real on the internet, and kids can get really creative. So make sure your sources are vetted.
Thanks, Sarah. Hey, Cody. How are you? Very good.
My name's Cody Andrews. I'm from the Skokomis tribe. I'm an addict. I've been clean for it'll be 21 years, but December 18th I'll have 22 years. Opiates was my main addiction. Methadone, I didn't hear it mentioned. Methadone was my main source when I got out of high school. So I really care about our people. So I'm always talking to Christine, getting Narcan, taking it to the drug houses, because, you know, there's a lot of times people don't want to go from the tribe. A lot of our Indian people don't want to go to Christine. They don't want to go to Ben. You know, it's just easier for me to get it from her, get the Narcan, drop it off at their house. You know, and I worry a lot about our aunts and uncles, our elderly, because we do get addicted to painkillers from the doctors. So I end up dropping a lot off to them too, because you got to worry about everybody that is getting stuff, because we all run out. We run out, and then somebody comes along and ends up handing us something, fentanyl, and we overdose. And you know, a lot of the people really know me on the reservation, so they end up calling me, and I'm saying, hey, don't call me first, call the ambulance. Because as Indian people, we're always scared that everybody's watching. So when I'm getting mad at the person to call the ambulance because they're scared, everybody's gonna know. And that's my biggest fear, is people that don't want people to know. I've had to holler at my aunts, you know, call the ambulance, you know, because it's scary when it's happening. You know, I've never had to Narcan anybody yet, but I've had people nodded out, you know, and I walk up to them and say, hey, I'm going to Narcan you. And they wake up. I'm sorry to say that, but that's what happens. Because as a drug addict, they hear the word Narcan, and it's automatic. They're like, no, I don't want to get Narcan because I don't want to ruin my high. And the scary part is they don't want to go to the hospital either because they know they'll get admitted, and then they're not going to be able to get their drugs. So it's pretty scary, you know, for a drug addict to, you know, just to get help. You know, and to get help, like Christine was talking about, insurance. You know, I was lucky. I worked for the water department for several years. So I had insurance, so I was able to go to treatment right there and then. But we struggle because a lot of people don't have insurance. And, you know, I always want to help, but I know they got to help themselves. And that's what happened to me. I was done. You know, I started in '89. Methadone first came around, you know, and I started. And I went until '99, and then I started wandering off doing meth, you know, just something where I was chasing that high every day. Finally, I dropped to my knees, and I started crying, said, I'm done. Totally done. Went to treatment. Lucky I had insurance. Was able to stay an extra 2 weeks because I asked them. But some of our people are not fortunate to have that. So, you know, I really care about our people, and I want to thank Mason County Public Health, you know, for Christine coming out doing the needle exchange, giving out the Narcan so I can hand it out to their people. You know, we talk quite a bit. I know where she's at. I go there, talk to her. You know, Abe used to be there too, so he was there when he was handing out the needles. You know, and that's just a program just to get them in so they could try to get them into treatment. It's not all about just handing out needles. It's about helping, giving them everything they can do for everything, you know, just everything in general. So I thank everybody that's here tonight. I know a young lady came to our council and wanted to know what we're doing. You know, she's at high school. She came and asked what we're doing about the fentanyl. But hopefully she didn't show up, you know, but I was really hoping she was going to show up here because she's really concerned about our people too. So I thank each and every one of you that are here tonight. Thank you.
Remember your cards. Remember your cards. Remember your cards. Matt, how are you doing tonight, Matt?
Good, and yourself? All right. Good evening. My name is Deputy Matt Golbinson of the Mason County Sheriff's Office. I'm a school resource officer. Worked at Pioneer. That's where I'm currently at. I've been at North Mason, been a lot of the schools in the county. So just recently, even prior to probably about a few months ago, we were asked to say, hey, could we do a class for our middle school on fentanyl awareness? And so I had to do a little bit of research as well. And the good news is, what I think we're just echoing here is our kids are, the majority of our kids are not doing this. And it's alcohol, marijuana, in very small amounts. You know, I think the biggest, issue that we probably have, I would say, is probably vaping. That's probably our biggest thing. But that leads me to another subject is, high schoolers, junior hires, they're they're pretty smart kids. And so when we start looking at trends and what's going to be the next thing, and we have, you know, THC that's in vape now, is fentanyl going to make its way into there? Because you can, you know, some of you know, you can get the cartridges that are just disposable. There's other vape that you have the actual vape oil. You know, is that going to be making its way in there? I don't know. You know, we've heard of, you know, fentanyl, you know, laced, you know, edibles. Have we seen it here? It's possibly out there. I want to really be ahead of the game. And that's why it's kind of educating things. Like, hey, you know, these things that maybe you think it's cool to go do or whatever, here's what it is. Because I went in there, I talked to these kids, and I said, you know, who all has heard of fentanyl? And maybe a third of the kids maybe raise their hand. And so I asked them, you know, what it is. Well, it's bad. They have no idea what it is. So then I get the opportunity to, you know, throw some numbers out there and start, you know, teaching math, and then they're like, oh, come on. And so what I do is I bring in like a little baggie that has like some salt in it, like probably about two shakes of salt, right? So not too much. And I show that to them. I go, okay, so right here is a little bit of salt. And so if this salt was to represent some fentanyl, if we all consume this, unfortunately, this entire school, it has enough power to kill everybody in here. And they're like, what? And I go, what is so dangerous is the people that's making this, you know, the drug dealers, they don't care about us, they care about making money. And so what they do, and so we do some math, so take the size of a grain of salt, right? So that's what's considered lethal. A lethal dose is just a little bit bigger than a grain of salt. So say your job as a drug dealer to, you know, take this grain of salt and say, well, let's do some math. Well, we know that one grain of salt could be deadly. So let's say, let's call it 4. So we'll, you know, crush this up in 4, and then now we have to make it into these pills. And so your job is to make sure that it's all the same. Well, that'd be really hard because like, none of us is a pharmacist or a chemist. And so you're trusting who knows who to put this small amount of this and make up this, you know, pills and put it in a pill and then hand it out. And then the fortunate thing, I said, you know, what does it look like? And so we have some pictures of, you know, other things like pills that they maybe take, you know, Xanax or something like that for whatever reason, or antidepressants or something that they may be taking maybe on a regular basis. And that's where the problem is like, you know, the danger is taking something that did not come from a prescription bottle that had your prescription on it. You know, taking it from, I forgot this today, so, you know, my friend has this. And so that's what we're teaching at the schools right now. So, yeah, but like I said, the good news in this is that we're educating this, and that, you know, I think the very small amount of our young kids have been affected by this, and we're going to go forward and make sure we're going to get down to 0.
All right, we're getting down to the last of it. You'll see Melissa's back there in her purple shirt. If you do have any of those cards that you've filled out, just hold them up, or you can pass them to the end of the row and get those to Melissa if you have any questions you want to ask our panelists, and she'll collect those from you.
Thank you. All right, good evening, everybody. My name is John Holbrook. I'm the Safety and Security Manager for Shelton School District. I've been there for about a year. I was in the Army for 14 years before that, and I've seen a lot of the damage that some of these substances can do through that. And so keeping those away from our youth is very important to me and is very important to the school district. You know, in the year that I've been here, we have 0 confirmed instances of fentanyl being present on our campuses. We have seen an increase in the last probably 6 months since this school really started of students being more comfortable coming up to their teachers and trusted adults and reporting when that might be on our campuses, and we investigate every report, and we'll continue to do that. We do have policies around youth substance use, and we really encourage and emphasize relationship building. So we really look to some of our counselors, our school nurses, and our admin teams to really work with some of the community agencies as well as families, sort of a comprehensive prevention and intervention strategy. Part of that policy as well is within our health curriculum. We do have classes that sort of try to get after that prevention piece, and so we do teach the effects of opioids and other addictive substances to the body. And then I would say lastly, you know, we did hire over the summer a new director of student wellness, and that individual's job is really to sort of link needs to resources and sort of build a comprehensive wraparound approach. And so really helping students get the need that they, or get the resources that they need working with those families. And just to reiterate, we're really not seeing fentanyl in our schools. It is mostly the vape pens. But we'll say after it, I would encourage families, talk to your students, monitor their social media. You know, if they hear something, if they see something, report it. Because we do want to make sure that our schools are a safe and welcoming environment. So thank you very much.
Perfect, perfect, perfect. Any cards that have come in? None. Oh, here, no, there's one coming in now. I want to ask a question real quick. Maybe I'll pose this to Christina. Bit of a hypothetical, but I know somebody right now who needs help. How do I go about getting that tonight?
Oh. Well, we have several behavioral health navigators. We have 3 programs listed. There's actually more. Will somebody from the public health table hold up our resource guide? Okay, so hot off the press, we just have a newest edition. So we have a behavioral health resource guide that we put out that has every behavioral health, so that's substance use and mental health resources that are in Mason County or adjacent. So we don't have all resources here, right? We have 0 detox facilities in Mason County. So if we don't have it in county, we'll list the ones that are nearby. That is a one-stop shop for all services, and we just increased our youth services listed significantly. So the first section is behavioral health navigators or case managers. We have the Quick Response Team, which is a program in partnership with Peninsula Community Health Services and North Mason Regional Fire Authority. They have a team that can help provide assessments and navigate to services. We have Olympic Health and Recovery Services, which is a behavioral health agency in Mason and Thurston County. They have tons of programs that have peer-run services, so people who have lived experience can help navigate and provide case management, and then also follow that individual through the recovery services, so you don't exit out of our program because you're doing well all of a sudden. And gosh, what was the third one? QRT, Olympic Health and Recovery Services. Well, we have the navigator, I didn't list that. Well, we have another one. I'm blinking it, so I'm sorry to the agent. Huh? Oh yeah, Northwest Resources SOS, so Dilma DeMartino, who's an amazing resource. She has helped countless individuals. So those are 3 programs that anybody can call any day of the week and say, hey, I need help. I don't know where to start. I don't have insurance. I don't know what my options are. The thoughts are overwhelming. I go online and I just don't know. So they can hold anybody's hand throughout the entire process. We can work with family members. There's also Jamie and I's phone number on the front of that resource. So please call or text us and we can help. There are so many people available to help navigate through services. And then, of course, you can call yourself if that's something you're comfortable with. But we have found that a lot of folks don't know where to start. They're afraid to take that first step. Maybe they call an inpatient and they're full and they lose hope. So we are trying to make that as accessible as possible. So please use us as a resource.
All right, Christina, keep the microphone. Okay. Where can you go to get a Narcan kit?
Okay. There are many places you can go to get a Narcan kit. First of all, you can get them at your pharmacy. So pretty much any pharmacy in Mason County you can get. There's a statewide standing order, so you don't need a prescription for it. There are some barriers depending on what insurance you have. So if you have Medicaid, I think it covers it 100%. You can get several kits at once. I can confirm that all of our local pharmacies, do carry Narcan, and they will give you a kit from your Medicaid insurance for free. Some insurances will cover partial payment, and some don't cover it at all. The nasal kits are rather ridiculously expensive. They're like $120, $130 per kit. That's very cost prohibitive. But if you do have insurance, that is an avenue, especially if you have Medicare. You can call me or come by our public health department. Our office is 415 North 6th Street. You don't have to remember that. It's written in that resource guide. So you can come there and get a kit. Or just call me. I'd prefer that so I can talk to you and make sure you know how to use it, and we can talk about prevention and aftercare. So my phone number is, again, you can call or text me. I can deliver Narcan anywhere in the county. There is also a new program. I don't think I have a link to it, but it's a state-run program in partnership with a program in Seattle that will do mail-based Narcan to, it's basically aimed for people who are rural, who can't access services easily. So it is a free program. You can get 1 kit per month, and it comes in a very discreet packaging. So if you don't want to talk to me, I understand I don't really like calling service providers and talking to them either. This is a very sensitive subject. So you can get that mail order. And then also behavioral health agencies. So pretty much any program that's working with folks with substance use disorder, I think are now required by law to give out Narcan to people with opioid use disorder. So if you're engaged in any treatment services, then you should be able to get one through your agency or at least get a prescription.
Perfect. This one might be for Sarah and from our law enforcement partners. What is the process if a student is caught with drugs on school grounds? Specifically opioids, but
Oh, for school?
yeah, you caught
So
with
if they're
opioids.
I know for North Mason School District, if you're looking for specific policies, they have them all listed on their website. But normally, so let's say if they brought them to like the health room, I would normally go and let admin know that I suspect that they're on something. We're not trying to make them think that they're, in trouble or anything like that. At that point, we just want to make sure that they're okay. Normally, we'll contact family because we don't know necessarily. Did you say, wait, if they're impaired or they have something
Drugs
on?
are on.
Oh, yeah, normally they would, okay, sorry, I was thinking if they were impaired. Admin would usually just step in. Oh, I'm sorry. Normally they would, the principal or vice principal would, get into contact with them. They'd contact family. I think that I think I've seen you at the high school multiple times I don't know about that necessarily, but depending on what it is, they'll contact law enforcement sometimes. I've seen it happen at the middle school. But as far as that, on my end, I don't do a lot with the disciplinary stuff. I know that if we are suspecting that somebody's using, we want to try to get them resources, so we'll get counselors involved. One of the biggest things is getting mental health treatment. So we have Peninsula, community health services that's literally on our campus. A lot of times we'll try to get them in to be able to talk to somebody, because most of the time for the youth, it begins as self-treating for something that, or self-medicating for something else that's going on.
Gotcha. Anybody else want to add to that?
Yeah, I'll talk about the process, and you can add. In Shelton School District, at least, True North has services available in Shelton School District. And something just for parents to know, a lot has changed in the discipline laws in the last 5 years around what schools can do and what they can't do. So it might be helpful to know what we used to do and what we do now. So before the discipline laws changed, we would get a referral anytime there was a discipline issue, either a student used on campus or was found with substances on campus, and they would be required to complete a substance use disorder assessment and follow recommendations. They were given that option, a 5-day suspension, or if they chose not to do the assessment, they would be given a long-term 45-day suspension. Almost all the time, they would choose the shorter suspension and a substance use disorder assessment. The laws around that have changed, and so for a first offense, you have to offer other alternatives. A long-term suspension is no longer an option. But policy still says they are referred to us and we do an outreach. Through that outreach, we're often able to use what we call motivational interviewing, but conversation with the student about why our services are important, why they might want to consider a screening, why they might want to consider assessment. And more often than not, we're able to get them at the very least a screening, and if the screening indicates that they need further assessment and into treatment services. The other thing I wanted to let you know, this wasn't really the question, but anybody can make a referral to our program. I think that's one of the things that's great is most of the referrals that come to our services are not disciplinary. They're either a school counselor was talking to a student, something came up, a teacher heard a student saw something they were drawing, and they make a referral to us because we can have that early conversation with them before it's disciplinary, before they're in trouble, and say, hey, somebody in your school community is really concerned about you, what might be going on, here's what we have to offer. Again, if you're just dabbling, you're experimenting, we have some early intervention services, we can put you in a group to get some more information. If you're living with people who are using regularly, we can put you in a group of students around those issues. And so we're really focused on those pathways that are not disciplinary when we can reach them early. And anybody, if you're a parent who's concerned about your student or a friend who's concerned, can make an online referral to our program, and we would do that outreach and have that conversation. Is there anything you'd add? Okay.
Perfect. Sarah, you were talking about this the other day when we were on a conference call. Are you finding marijuana laced with fentanyl?
So that's a great question. We are hearing that that is something that's happening. Now, we don't have the data that supports that. We do know that most of our students who are using, or most of our clients who are using marijuana are using with vapes at this point, and so it's a completely different drug. So a couple of things that we're hearing from parents are, my kid says they're using marijuana, but they are acting in a way that I do not believe they're using marijuana. A lot of times it is marijuana, it's just really high potency. So that's something to note too, like not even outside of opioids. The typical response that I think a lot of us who are older expect from marijuana is exacerbated because it is such high THC potency at this point. And so we're seeing kids who aren't just like chilled out and like, kicking back on the couch, but they're like having manic episodes or they're acting in these ways that are just like counterintuitive for what we expect with marijuana. So I do know, not here, and maybe law enforcement can talk more about this, that I've heard schools in King County are now testing their vapes with fentanyl strips to see, because they are also hearing that it is in vapes. But again, I don't think we have enough information to know if that's something that's happening or not.
Perfect.
Did I get that right?
Yeah.
Okay.
Perfect. All right. I'm going to paraphrase here a little bit, but we know that out in our community, I'm using a term, drug house, a place that looks like it's pretty tough. And there might be youth that's involved. What could a community member do to check on the status of youth that might be involved in a pretty troubling housing situation where drugs might be present? Anybody want to field that? That's a tough one.
I think that might be a law enforcement question, but my first instinct would be, have you had a conversation? Have you said to the youth you see walking into that house, hi, I'm a neighbor, what's going on in there? Who are you? This is who I am. I think a lot of the answers start with conversation, so that would be my first thing, is like, find out more. Are they willing to talk to you? Are they willing to tell you who they are? Are they willing to build that relationship? Something that always resonates for me is the #1 resiliency factor for young people is having a positive relationship with a caring adult, and we never know who that is. And it's often surprising when we hear from young people. It's my neighbor down the street who says hi to me every morning. It's my bus driver who asks me how I'm doing. It's like, it can be anyone. And so it could be you saying, hey, you're hanging out at this house a lot. Who's there? What's going on? I don't know if law enforcement has a different answer.
That's good. I think the best thing is to ask questions too, and don't be afraid to talk to people, especially your neighbors. And one thing you do is also, if you know the kids are, there's a lot of kids in this community that do have like a school resource officer, at their school, or have the ability to talk to one. And so a lot of times we'll have a lot of insight on a lot of kiddos in our community, and probably could intervene that way as well.
All right, Maggie, this one's for you, because you touched on this, but I really want to hammer this home because this is something that's new this year. How many of the schools in our district, and we'll maybe just talk specifically about North Mason, are prepared to handle an overdose from high school all the way to elementary school? And are the staff trained to handle an overdose if one should occur in the schools?
Yeah, so for North Mason School District, we have all of our admin in every single one of the buildings. We want to start to train more, but we want to at least get the basics down so the people that are, running the buildings, we probably will get even like the secretarial staff, people who are having the most interaction with people, we're going to move on to training them too. But at every single building now, there is some, or at least a few people that would be able to administer Narcan. And then we have the 4 doses of Narcan in each of the buildings, including possible overdose around that area too.
So I have done, and this is not saying that the other schools do not have Narcan or have training, but I can say that I have individually trained the North Mason School District, Hood Canal Schools, Great View School District, Shelton High School. Shelton High School shares a nurse with Choice School, but I have been in conversations with Choice to do a little bit more. And I have one scheduled for Pioneer Schools. I can provide, I also did a couple of years ago, I think, an overdose response. And I like to say overdose response, not just Narcan, to the ESD, is it 113 that we shared with Shelton and Olympia, with their whole school nurses. And I also presented at the School Nurse Association of Washington conference in 2020 for all Washington schools. So we are happy to provide those trainings for any and all school staff. I do recommend that it be more than just the administration, because a lot of times it might be the teacher who's recognizing the symptoms, so we want to make sure that people can recognize the signs immediately, because that time from initial overdose to not breathing and cardiovascular response can be pretty quick, especially with fentanyl. Fentanyl is a much shorter acting opiate, so that overdose can get exacerbated much quicker. So if your school is not listed, please encourage them to contact me.
Perfect. Maybe right along that line, what can community service clubs, Rotary, Kiwanis, Eagles, etc., do to help with prevention and overdose prevention?
Well, Ben Johnson, my colleague at Mason County Public Health, has a substance use prevention coalition with many of the schools and works with students. So Ben Johnson is the prevention expert, and I don't know if you want to jump on the mic and talk about that. As far as other clubs and schools, we're always happy to do presentations and conversations. With Jamie Taylor, our coroner, we presented at the Belford Voice just a couple months ago, I think, and we have done several presentations just about what resources. So we can do overdose. We can also just say what resources are available, especially folks who work in like clergy or in religious-based organizations. I think those are really well positioned to help folks who are in need and who need help. So we can, I think, just having a conversation and having this destigmatizing, right? So the more we talk about it openly, the more folks have accurate information instead of fear-based information, the more we're positioned that we all are to respond quickly.
Perfect. And then going back to the original question, bus drivers, school bus drivers, it's not just folks that are, our teachers that are actually in the schools. Is there training that's being done for bus drivers? And if not, is there an opportunity for that?
I don't support here. For North Mason School District, they haven't done bus drivers yet, but I think it's something that we'll need to bring up because I think it's a great idea. Because those are a lot of times kids on their way to school and leaving school. They're interacting with friends. They're having access to different things depending on what they're doing, and that is a big possibility. And
I don't know if any bus drivers have been in my trainings, because sometimes there are a lot of people. I don't think so. We're of course happy to. We'll do overdose response trainings to literally anybody who asks. So that is a good point.
Perfect. Christina, you got to keep this to a minute because I know you're passionate about this. Fentanyl use, as we see it's changing, you talked about the needle syringe program. As we see fentanyl use, we're seeing more smoking and ingesting. With that being the case, is our syringe exchanges keeping up with, as far as handing out supplies,
Harm reduction supplies that pertain more to smoking and ingestion, which we're seeing the trend move towards, are those resources available at our syringe exchange locations, as is prevention and prevention materials at those locations?
Who wrote this comment?
It wasn't you, I know that.
I cannot talk about this at length. No, I think there's a lot of barriers right now. Our programs are not well set to adapt to the changes that we're seeing. We are seeing a huge shift in route of administration from using. So whereas a lot of people used to inject drugs, a lot of people are not injecting drugs anymore. People are actually stopping, and they're moving to smoking. Some programs in Washington State and around the country are able to give out safer smoking supplies, and that's not something that we are currently doing. We do have lots of other supplies at the exchange, so we are not just a syringe exchange program. We have a peer navigator, somebody with lived experience, so we connect people to resources immediately if they want or can case manage them. We have lots of wound care supplies, hygiene supplies, we have sleeping bags, socks, all sorts of other things that will bring people in. But that's a conversation that I would love to have and keep having. And as far as prevention services, we have lots of good relationships with folks. We talk at length about prevention. We talk about, prevention means a lot of things to different people. As far as primary prevention, which is like stopping people from using in the first place, that's not where my specialty lies. If somebody's coming to, services who are pretty well into their substance using career, those conversations are a little bit less needed, but we can always send people to the folks who are expert, and we use our resources a lot.
Perfect. Thank you. Are there test strips available in Mason County for fentanyl that might be laced in other substances?
We do provide fentanyl test strips. They are a very imperfect tool. They're something that we have. They are a tool in our toolbox. You can get them at our substance use mobile outreach, and then also sometimes at our transit center outreach table that we partner with Olympic Health and Recovery Services. So we do have those available. Other agencies have asked me about getting them. They're very imperfect. They don't work well on methamphetamine. In my experience at this point, most people who are using opioids know that they're using fentanyl. They can work well if you're using heroin and you don't want fentanyl-laced heroin, but they are not accurate for methamphetamine. You have to do them very specifically, so I don't recommend them. We don't want people to have misinformation, but we do have them. There are new strips that are coming available soon that will have less false positives and will be more accurate, and we are waiting to see what those look like and how much those cost.
Gotcha. Is there a safe use phone line that's available? And if so, is there one that's available for youth that can use it without the fear of getting into trouble?
There is a national hotline called Never Use Alone. Oh, we should put that in our resource guide. I didn't even think of that. So there is a volunteer-run national hotline called Never Use Alone. You can find the information. This is for people who are using alone. Using alone is the #1 risk factor of experiencing a fatal overdose. If no one knows that you're using, they cannot get help. No one can find you. So the way this phone number works is you give them, the operator will take your first name and your address, and they'll either stay on the line, they can chat, or they cannot chat. You don't have to talk to the person on the line, but if you become unresponsive, they will alert the paramedics to your location immediately, and they have saved many lives that way. So that is something that we can all use. There are lots of reasons why people will use alone. Stigma is a lot of one. A lot of people use it, have a lot of shame around their use. A lot of people go very far to make sure that nobody knows that they're using. They're using in secrecy. They will drive out pretty far into parking lots and lakes and other pretty rural areas so that no one can find them, but unfortunately that's extraordinarily risky. So Never Use Alone is a great resource, and I don't think they have any age restrictions. They don't ask at your age, they don't ask any information.
Perfect. Albert, do you mind coming up for just a second? We're going to have a guest panelist here for just a second because this is a really good question that came in. One of the things that we've not talked about tonight is medically assisted treatment. So if you're not aware of what that is, I'll have Albert talk about it a little bit, but when we talk about Suboxone, we talk about Vivitrol, we talk about different medications that can be used. We definitely know that that's available in the adult population, and we're having success with it. How about specifically in the youth population? I'm putting Albert on the spot because he's a pharmacist with Peninsula Community Health, and he was actually got asked this question today at our stakeholder group meeting. So Albert.
Yeah, apologies for being the pharmacist hiding in the back here. So there was a really good question about what are the 3 medications that we use for treatment. So there are 3 medications that are currently available. Methadone has been around for a long time, so many of us have heard of methadone clinics. It is a very highly regulated medication. It is a full opioid, and for that reason, there are some very specific places that you can get that. So currently, there are no methadone clinics or opioid treatment programs within Mason County. There are ones in Kitsap County, as well as in the Tacoma area, and there are other ones that are becoming available. There is another treatment called Suboxone or buprenorphine. Buprenorphine is available through office-based treatment, which means you can go to your local prescriber and get opioid, or this partial opioid, which helps people feel normal. It helps with withdrawal symptoms. It gets to the point where people are responsive to other forms of treatment. So we often get the questions as pharmacists, aren't we replacing one sort of opioid with another? And kind of. But what the idea of both methadone and buprenorphine are is that we're replacing it with a long-acting medication that keeps people in the range where they are not having cravings, they're not actively having withdrawal symptoms, and it also is providing protection for the other illicit medications that could be higher risk for overdose. Finally, there's naltrexone, long-acting naltrexone, which is known as Vivitrol. That's an injection, and this injection blocks opioids altogether. So we kind of think of it as abstinence plus some protection. So those are the 3 medications. Whoever wrote this question knew what they were talking about because 2 out of the 3 medications, buprenorphine and methadone, have been clinically shown to reduce the risk of overdose by 50%. And so when I talk to our providers about that, we all know that if you're taking your best blood pressure medication, your best cholesterol lowering medication, even if you're taking that for years, you're maybe lowering your risk of death by maybe 8% or so. With these medications, you can lower your risk of death by up to 50%, within 6 months. So very important. The one thing I'll point out, because there is a lot more that you can learn about it, is the learnabouttreatment.org has a really fabulous chart. I will admit that I hand this out not only to our own prescribers at PCHS, but I also encourage all of our patients and family members to look at learnabouttreatment.org because it is one that is put together by the University of Washington. So great resources both for people who want to learn really in-depth information, prescriber level information, but also for friends, family, anybody who wants to learn more about the medications.
Albert, specifically to you, Ken, those
Yes.
medications specific to you.
Forgive me, I went off topic, but for youth, so just like many medications, we don't typically get a lot of research in our younger patient population. And so for that reason, we are working very hard to learn more about this. So there is some preliminary research that says, like its effectiveness with the older adult population, there is effectiveness with our young adults and potentially even adolescents. We want to just point out that, again, treatment is treatment, and so while medications is one option, There is also counseling, as we've talked about, as well. We really want to make sure that any treatment plan is individualized to the individual patient in front of us. And so what that looks like is a very personal discussion, both with the patient, family members, and the providers. Right now, the medication is labeled for 16 years and up. However, we use a whole bunch of medications off-label as well for kids that are younger than 16. It is just very much a individual discussion to be had because we are learning more and more each day.
Thank you, Albert.
Is it working? Okay. Yeah, so I'm Ben Johnson, Mason County Public Health. I'm the Substance Abuse Prevention Coalition Coordinator. And I really just have a couple of announcements. First of all, I want to thank our facilitators, and I know you're going to do this too, but I want to thank Bo and Abe for stepping up tonight and facilitating tonight. They've been a great collaborator in the last 6-7 years since we probably did our last big forum. And I think we're going to be talking about doing another forum in the future. It's on the table anyhow. So the other thing I want to do is thank our coalition, our Substance Abuse Coalition members who are here tonight. If you can raise your hand really quickly, we've got about 6 or 7 of them. This group of people have been meeting, especially this core that's here, has been meeting for the last 7-8 years on a regular basis, once a month, trying to come up with some innovative prevention programming for our students in Mason County. We have a meeting next Wednesday at 3 o'clock at the North Mason Youth Connections building, and you are welcome to attend and be part of our coalition. We are always looking for help. If you're interested, please leave your name and your email address on the table over here. We also have a community survey that we've been asked to do every year. Our goal is 200 surveys in our community. We are at 172, I think, yesterday. So we're getting close. If you have a phone that will take a QR code, it only takes about 3 minutes to do the survey. It's an opinion survey of what you believe is happening in our community, and that survey actually helps us kind of guide what we're doing in our programming. It's really important. We use that survey a lot, and we use the Healthy Youth Survey that Christina mentioned earlier quite a bit, not quite a bit, a lot to guide our programming. The coalition provided the water and the snacks, so take some cookies home and maybe a water home. And we have the surveys right here. We're doing a drawing after the 15th, a couple of two-ticket nights for the movie theater downtown, and there'll be snacks along with it. Our coalition actually has raised money over the years, so we're able to help with projects like this. And we had a great team that Christina mentioned. Christina, we had Jamie, Rebecca, Cesar, who was here earlier, set up, and our coalition that helped out tonight. And I know Diedrich was already mentioned earlier. So thank you, and I really appreciate everybody coming tonight.
Awesome. Thank you, Ben. We are running just a couple minutes over, but yes, thank you to our panel. I believe that as we break and we're milling around our panelists, if anybody wants to catch them one-on-one, please do so. We're going to be breaking tonight and leaving and heading home, but that does not mean it's the end of the community conversation. A big thank you to Mason County Public Health, to the entire panel for being here tonight, both this morning and tonight to most of you. It's been a long day. But we will be continuing this conversation, and as we walk away, the work will continue. Christina's going to wake up tomorrow morning, go back in and right back at it, as will most of our panelists and the folks that are pushing back on this issue. But please connect with our resources here. You can't let those cookies go to a fire station. You got to eat those on the way out. And again, please connect with our panelists and anything you need. Jamie, you're There she is, hands up. All right. Thanks for coming out. And again, this is a continuation of a very important topic for our community. Appreciate it.